Make sense? All right. The simple running locking suture, we can just watch that, okay? And then the running subcutaneous is exactly the same as the one on the skin, except you're running it in the subcu.
You start off the same. Okay. Simple bites. Nice little straight side. And this is a very helpful suture.
So the running locking stitch, okay, is maybe a little bit stronger. The
variation of the simple
data on that is a little bit gray, whether it is actually a more strong stitch and whether it may actually cause some ischemia because of the way it's locking and tightening down on certain spots of the wound. But this is how it's done.
This is a very helpful suture when you're sewing under some tension, especially when you don't have an assistant who can help hold the suture for you and follow you. You'll take your simple bites again, 90 degrees, you invert the skin edges, but before you pull up, you'll make sure and actually lock the suture. And take your simple bite, and again, before pulling up the last little bit, you'll lock your suture. And you can go on from here, and the beauty of this is that, you see, although it's loose here, it is locking back here. And so when you're under a lot of tension, especially, it'll hold for itself. Now sometimes I'll do a running stitch, and I'll plan on doing a running locking, but at some point in the middle of the suture, it starts loosening on me, and then you can just throw in one of these locking sutures. Always keep it nice and tight.
So the point he's trying to make when you're doing a running stitch is what you can get is the stitch behind where you gang can loosen up a little bit, and then you get too far along and you can't get the tension back into it, okay? So you need to be careful when you're doing a running stitch that when you're doing that, you're going ahead and keeping tension. So after you go through, you pull tight each time and then pull back and keep tension, okay? If you have an assistant with you, what they'll do is they'll hold the thread in the back and hold the tension while you take your next bite, okay? So this can be used, like I said, you can go and run 3 or 4 stitches, okay, and then do a lock, okay, if you're by yourself. If you got someone helping you, you don't ever need to do it, okay? But if you're by yourself suturing, you know, and you're doing a long run, you can go ahead and run 3 or 4 stitches, make sure it's nice and tight, lock it, okay, and then go ahead again, okay? If you're doing a subcutaneous running stitch, sometimes what you'll do, if you're planning on pulling it out, like I said, like this, what you can do is you can do some Q, okay, and leave the tails underneath, okay, with steri strip, okay, but maybe pop out in the middle of the wound once, come out, and then go back in, and that allows you a place to cut in order so you can pull out from both ends. Okay? Make sense? Okay? Alright, so we'll just watch the running subcuticular, and then we'll spend just a minute or two just on hand tie. Okay? And then everyone's good to go. The instruments are yours, okay? The suture's yours, and the pad is yours to take home. Okay? These work okay. This actually worked better than I thought. I was trying to figure out something that we could bring over here that because getting the other kits from Ethicon were a little bit hard. They're expensive if you have to buy them. And this actually, I think, mimics sort of well, okay? Yeah, cost me $1 each, okay? All right, but they mimic having a subcutaneous layer. I think that what we need to do is probably get just a piece of wood underneath that's heavy and just like staple or, you know, a thumbtack or something just to hold it down when you're practicing, okay? So all the instruments are yours, the suture's yours. I think what I'll do is we'll distribute the rest of the suture to the group today. All right, so you have some extra stuff to practice with, okay? Since I'm leaving Sunday, I'm not going to teach the class again this week. All right, and we'll see if we can get you some more suture next time, okay? Did everyone find this to be an effective format? Yeah, good way of doing it? I think having the video, it's a little too hard to teach lots of people while you're watching. I think it's nice to see it and then, you know, practice a little bit. So we'll go ahead and I'll just show you the running sub-Q, okay? And then when you guys send me your email, okay, what will happen is when you get, I'll do it in maybe a couple days, okay, I'll send it back to you and we'll get everyone, you can register, you don't have to come to the library, you can register as a membership, just do an online form. When you get that, you will get an automatic email from us, okay, that will give you Hinari password, okay, and we'll give you the global EDU password, okay, and we'll tell you how to set up the web browser, okay? All right, and our YouTube, okay?
Our next stitch is a running subcuticular suture. Out of all the sutures we're teaching here, this is probably the hardest to master. This is probably for the most cosmetic closure, as you're running within the dermis deeply, so there's no sutures on the outside at all, so you won't see any of the railroad tracking you would see from any other outside sutures. This is an absorbable suture, and we will start by burying the knot, so I'll go deep in the corner, away from the skin. This is the very deepest part of the dermis. We'll do our instrument tie. This allows the knot to be buried, so we can suture over it. This is important because...
All right, so everyone see the first part of that stitch? You're starting about, 8 to 10 millimeters in, okay? You're starting deep in the wound, just like a regular buried stitch. And you're going to come out at the apex, and then you're going to go in at the apex, and you're going to come back out at the base and tie, okay? And then you're going to run the rest of it, okay? Make sense? And we'll see you again.
We don't want knots coming up to the skin. They can stick out. It's called spitting.
Okay.
The deepest part of the dermis.
Let's do this one more time.
And we'll do our instrument tie. This allows the knot to be buried. Closure. As you're running within the dermis deeply, so there's no sutures on the outside at all, so you won't see any of the railroad tracking that you would see from any of the other outside sutures. This is an absorbable suture, and we will start by burying the knot, so I'll go deep in the corner, away from the skin, maybe just the very deepest part of the dermis. And we'll do our instrument tie, and this allows the knot to be buried, so we can suture over it. This is important because we don't want knots coming up to the skin. They can stick out. It's called spitting. Patients do not like it when the knots spit. Now the knot is deep, so we're going to go deep and then we're going to come superficial and then bring this right up to the corner. And this is where we're going to start our subcuticular run. When you start or you're close to a corner, definitely recommend smaller bites to start. See, I'm just within the dermis, a horizontal bite. I need to advance a little bit on the other side. I take another small bite, again, stay well within the dermis. Now with this stitch, I'm always asked is how much do you advance each time? What I like to do is to see here at my suture where the next bite should be. And that's where I'm going to put it. So in some sense it depends on how much tension there is. On this wound, there's not a lot of tension. Now we're going to start to take regular bites on each side. I'm trying to take the same depth and the same amount of tissue each time. So you begin to advance. Keep pulling everything up and keeping tension. Notice I'm not pulling up very tight either. Just getting the skin to approximate. No buttonholing of the skin. This is just pure horizontal dermis. Let's to come right there.
So there are two variations to the start. You can see how he did it. He just went deep and then tied back to itself and then started doing the stitch. The alternative is you can go across the room with the stitch, okay? Like you're doing a regular, simple, interrupted, subcutaneous, right? Boom, boom. And then you go ahead and do the same thing. You're going to go ahead and advance and then straight around. All right? I usually throw a full stitch. So what I do is I start about 8 millimeters and I go from deep and I come out at the apex. And then I go apex and then circle back deep. And so basically, instead of going straight across with your subcutaneous stitch, mine looks more like this. See, it's on the slope. So the deep is advanced, the knot buries, and then I come to the apex, okay, for my tie, then back to here, and then I start running. Okay? Make sense? You're going to see lots of little variations in how people do things, okay? That end up about the same, all right? So, as you can see, you know, there's been 3 or 4 different sort of almost the same way of doing the same thing that you saw in the video, okay? So, you know, you get comfortable doing one thing or another. There's not always a perfect way of doing something. Sometimes there's a couple that are just as good, all right? But these are just slight variations. Now, the end of this stitch is the difficult part, okay? And this is what we need to watch.
Can you get a good bite of barrels?
I'll frequently do this type of stitch and then either steri-strip the surface or glue it. I love using glue. You guys don't really have it in your country very much. Dermabond, yeah.
Just like when we started, as you begin to approach the corner, you want to stop taking such big bites and start going to some smaller bites, because you really want the skin edges to be well approximated at the corner and not create any dog ears. We also want to bury our knot. So if we're going to bury our knot, we have to start thinking about getting deep with both of the 2 ends that are going to get tied. So at this point here, I'm superficial, and I'm going to go superficial on this side and then head deep. That'll get me down to sort of where we're starting, down deep. Now I'm going to take one more bite that's deep. Now I'm going to tie that. That'll help to bury the knot.
Okay.
Now what I'm going to do to help bury the knot is what...
Okay, so again, when you get to the end, okay, what you're going to do is your last stitch is going to be just like you're doing a simple one. You're going to go at the base, come to the apex, okay? Go apex into the base, and then you come back, you have a loop. Now your loop is facing this way, okay? That's the orientation, okay? Superficial at the apex, at the very end of the wound, and coming back to form a loop, okay, that's going to tie, like this, okay? That knot gets tied back on itself, okay? So you're tying back on the loop, all right?
Well, let's cut the short end here right on the edge of the knot. Now take the needle.
Now watch.
Bury that knot further. So I'm going to pick up here and see where the knot's going. And I can come out through the skin nearby and just simply pull up on this. I can just cut it flush with the skin. That helps our knot from suture.
So you loop back behind the knot.
Back and forth this course.
And then go out
We do
beyond the
feel
loop.
strongly that excellent surgeons begin with excellent.
So you're going back behind your knot, okay, and then coming out in front of the knot by going underneath the knot. And what that does is it pulls the tension on that knot down and deep into the wound, okay? And then you pull out maybe a couple centimeters, you know, or a centimeter from the end of the wound edge, okay? And pull it tight, and then clip. And that keeps tension pulling away. Make sense? Okay? All right, so that basically concludes things, okay? I've given everyone some thread, okay? What I used to do, okay, is this. All right, you got your scrubs on, right? Your scrubs tie right here. They become basically